Dr. Haritha Desu is a postdoctoral neuroscientist at the Centre Hospitalier de l'Université de Montréal Centre de Recherche in Montreal. How did I do? Okay?
That was pretty good.
Dr. Desu's research has focused on how immune cells, like T cells, interact with the cells already resident in the brain to drive damage or potentially promote repair. And Dr. Desu is at the ACTRIMS Forum presenting research that focuses on how these so-called sticky immune cells stay in the brain to keep inflammation going. Your presentation here at ACTRIMS discusses how ICAM1 helps immune cells stick around in the brain. For someone living with MS, why is it so important to break that stickiness?
Sure. So the reason MS, or people living with MS, are experiencing the symptoms they are is because their immune cells are attacking their central nervous system or their brain, and this is what's causing the damage that's there. And in later, more progressive stages of the disease, the damage doesn't get repaired. And so by making the cells less sticky and preventing them from staying in the brain, that means that we can hopefully stop the damage that's occurring and maybe even help the brain repair itself.
That was kind of going to be my follow-up, whether this is kind of a key to stopping that compartmentalized inflammation that causes progression.
Yeah, hopefully. That would be really wonderful, and that's what my data suggests so far, at least.
We often hear about drugs that stop immune cells from entering the brain. Your work looks at what they do once they're already inside.
Exactly, yes.
How might your research help us develop treatments for people who already have active inflammation within their central nervous system?
Yeah, so I am looking at what they do in the brain, but at the end of the day, they are originating from the peripheral body, and they're sort of circulating in the blood. And one of the difficulties with developing therapies for MS is that most drugs can't cross into the brain to do their therapeutic effect, or to have their therapeutic effect. So if we are able to find targets on the peripheral immune cells that can potentially stop them from sticking around once they're there, and that means that we have found a marker that, or a target that would be accessible through the outside system, and that is really an amazing finding if if it ends up being true.
Most MS drugs work by turning off parts of the immune system.
Yes.
However, your work on what's called tumor necrosis factor receptor 2, or TNFR2, which is a specific target that might actually help the brain heal itself. Your work suggests we could turn on a receptor that actually protects the brain. How close are we to a therapy that doesn't just stop damage, but actively promotes myelin repair?
Yeah, so the TNFR2 results are from my PhD work, and it is very exciting because when we remove this receptor, it actually makes, in preclinical models of MS with animal studies and cell culture, we can see that it makes things worse. And when we add a activating antibody, it can help reduce the inflammation. And however, there is still a lot to be done because the activation that we would want to see is within the brain. As I mentioned, it's hard to get therapeutic targets into the brain. And so we would have to do a lot more, I think, studies in the lab before we identify a molecule that could activate TNFR2 and really enhance the protective effects of this receptor. But it is certainly very promising, and I was really excited about my graduate work when I was doing it.
You've also spent a lot of time looking at NFL levels.
Yes.
And this week, leading up to the Super Bowl, I guess it's important to mention that in this case, NFL is short for neurofilament light chain, a protein that's released into the bloodstream as a result of nerve cell damage. And you've looked at NFL levels in different clinical subtypes.
Yes, that's right.
Can these fluid biomarkers eventually tell a patient sitting in a clinic what their disease course might look like, and maybe more importantly, which drug will work best for them?
Hopefully. I can't comment on whether or not NFL would be the biomarker that would do that, because there's still a lot more ongoing studies that are trying to determine exactly that. At least from what is published so far, it seems to be that NFL is not just a marker of more disease severity, but it's also something that increases with age, and there's a lot of other factors that could be influencing its levels, so it's not MS specific. However, there were some very interesting presentations this morning on protein biomarkers that could be predictive or that could potentially be involved in continuing or MS progression, I would say. Yeah.
People living with MS are often confused by the labels primary and secondary progressive MS.
Yes.
From a biological standpoint, does your research show that these are actually two different subtypes, or are we just seeing the same fire burning at different speeds?
I would say that I think the consensus in the field now is that it's the same fire, just burning at different speeds. It's definitely both are progressive forms of the disease. It's just that the people that are affected with SPMS are diagnosed with it after they have relapsing attacks, and people who are diagnosed with primary progressive MS usually have their progression starting from their disease onset. But when it comes to the underlying biology, it is pretty similar. Yeah, I would say there's not many key differences that we have now.
Dr. Haritha Desu, I want to thank you for all you do to improve the lives of people who are living with MS, and thanks so much for talking with me today.
Thank you for having me.